So when you talk about the clinical manifestations, all of them have constitutional symptoms, your fatigue and, a lack of energy, the asthenia, all these things. Okay. You called it as asthenia. Okay. Asthenia or lassitude. Okay. Fevers, all these things are very much common in all the types of vasculitis. Okay. But there are certain things that you have to remember. When you talk about the kidney, the disease that hits the kidney very badly is MPA. Okay. The disease that hits the kidney very badly is MPA. So MPA is 90 percentage affliction of the kidney. EGPA far less. So that's one important thing you have to know about EGPA. So to the nephrologist, EGPA is a disease that he is going to see least because EGPA affects the kidney the least. The nephrologist will see Church straws very less because it may not come to him because the kidneys are less affected. Okay, whereas MPA, really MPA and even GPA. When you talk about skin and cutaneous manifestation, that is the vasculitic rash, that is fairly equal in all the three varieties of vasculitis. When you talk about the lungs, okay, when you talk about the lungs, the lower respiratory tract more commonly affected in GPA and EGPA. Okay, GPA and EGPA, you can see 90% here. Okay, when you talk about the upper respiratory tract, very, very important point. When you talk about the upper respiratory tract, the ENT, GPA. GPA stands out there. Your vaginous or your granulomatosis with polyangiitis has very, very common ENT manifestation, upper respiratory tract manifestation in comparison to the other two varieties. So you can see that the microscopic polyangiitis has very less respiratory system involvement overall, 50% for the lungs and only 30-35% for the ENT. And then you have your musculoskeletal, neurologic, and gastrointestinal. So these are very important MCQ points. That's why I've highlighted. So which affects the kidney the most, which affects the kidney the least, EGPA, very less, and the upper respiratory tract more for vaginous. So when you have a clinical case vignette, and then all these telltale signs are there, it's easy for you to get the answer. And the abbreviation that I've put at the bottom of the screen, BVAS, it is a scoring system for scoring the disease activity. It's called the Birmingham Vasculitis Activity Score. Okay, let me write it down for you. Birmingham, all of you know the place in England. So Birmingham Vasculitis Activity Score. Very important for you to know BVAS. If not the components, at least BVAS, because all the new drugs, any new drug that is being studied in ANCA vasculitis is studied in this manner. How much BVAS is it reducing? Okay.